just speaking from its benefit beyond just the patient clinical outcomes, Dr. Kretikos, can you explain a little bit about what this, us making ground on getting this new drug class onto the market? What does this mean for, I guess, the state of research and how it's going to advance now for HIV?
Well, that's a good question. I think, for a while we were stuck with just improving in different classes of medications that were already available to us, the integrase inhibitors, the protease inhibitors, and to have an area where, but there was still cross-resistance within those classes. And the other concern is that there's cross-tolerance issues. So, for example, if you have a significant side effect from an integrase inhibitor, it's very likely that that side effect will persist with other integrase inhibitors. And this patient population sometimes cannot use a class because of tolerance issues. This gives us a whole new class that brings an effective drug in a different class to the table for this patient population.
That's excellent. That's great. And regarding its approval, it seemed like it got the nod from the FDA, I think a couple months before its anticipated PDUFA date, right? So obviously, a strong showing of evidence in the BRIGHT trial and previous assessments just by all means made it something that we can streamline. And if we're talking about real world application, if this is a drug that's going to be available as soon as tomorrow for the right patient, what does this mean? How many patients exactly fit into this mold of who would be eligible for this?
Well, I think in terms of statistics, we're talking about, 5%, 6%. So that's 1 in 20. That's not an insignificant portion of people living with HIV. We also forget about the fact that by helping these patients achieve an undetectable viral load and stay healthy, we actually are also impacting transmission. So treatment as prevention is still important for this patient population as well. But we have to remember that these patients are still a very important portion of our practice. Again, there's been a lot of emphasis on prevention, of course, and the newly diagnosed and the wonderful new regimens that we have for them. But it's just a real blessing to be able to have something new to offer patients who have advanced disease. And these are people who are survivors. So they are, we have to recognize that they are individuals who have so much to offer this community because of their history and their experiences and their persistence.